So we are excited to invite Ms. Vijaya Sen, who is the Group HR Director for Zulekha Healthcare Group in the UAE and Alexis Hospital in India. Ms. Sen has been working with IFC at least for about 6 years. She joined the She Works partnership that we had, which was a similar initiative, which we kicked off in 2014, that looked at gender equality within the workplace, and Zulekha was well represented by Vijaya. So she's going to share her experience and also the work that they continue to do. She has over 30 years of experience in diverse sectors, including healthcare and manufacturing. And she has worked with leading multinational corporations such as General Electric, doing talent development, talent acquisition and management. She's very passionate about organizational development. And so we know that this is really near and dear to her heart. So thank you, Vijaya, for being with us, and over to you. Thank you.
Thank you, Sanola, and thank you all the team members over there from IFC. It's really a pleasure for me to share something which we did very diligently about 6 years back. And that was about the She Works. So I wanted all the members who are participating in this program to understand what was the program about She Works and what we did. And it was such a unique concept which we brought here. And we were the only one organization in UAE who drove this program. And now when I was hearing to Jamila and Senola's, the presentations, I was so, everything was so relatable for me, because we did take one of those steps as a measurement for us, and we drove the same lines, So I would definitely, would like to share all those. So before that, let me just take you through the She Works, what was She Works about and what it is. So can we show this next slide, please? Thank you. Well, the She Works was a program which was driven by IFC, and this program was launched by World Bank Group President in 2014. The program, the initiative was to drive employment opportunities as well as drive women empowerment, across the globe. And we wanted more and more members to participate in this program. And when we signed up this commitment, so it was like a 2 years commitment. The member participating in this program were from almost all across the world, and there were about 13 people who participated for this program, out of which these were the member listed whom we have just given the logo here, like SAP, Coca-Cola, CARE, Zulekha, of course, was one of them. And like that, many of these organizations participated. And you will be really amazed to see that in 2 years, the target which we wanted to achieve, that is about 300,000 women employment, we did cross that number. And this was driven with driving certain measures with certain commitment. And of course, the data was the backup for that. Can we move to the next slide, please? Thank you. So it was definitely a knowledge sharing forum, and the member participating, it was like a diverse industry. It was not just healthcare. We were the only one who were healthcare. So we were very well supported by the International Labour Organization and other like UN Global Compact also. So what we did is that we picked up these kind of basic subjects, the 6 measurements which we had taken to look at it, and then we looked at each and everything for us to go about it. But like as a member participating, we had committed for 3, and most of these companies had also committed for 3 measurements. So majorly, we focused on women in business leadership and management, recruitment and retention of female talent, which we spoke today. And, like we were talking about the safety or the good environment, conducive environment for women. So we wanted to implement something on the anti-sexual harassment. We worked on supporting women in the value chain as employees and entrepreneurs, measuring and reporting on progress. And lastly, the leadership public commitment to women's employment as a smart business strategy, which was the most important thing, which I feel that, any organization who gets into this kind of program, it can be very well driven when it is a top-down approach. So the leadership commitment is very, very important to drive this program. So we also did the same thing. So I would like to share, our achievements and how we did it. Before that, this is how we concluded on the She Works thing. The women's employment numbers went up more than 60%. In our case, we achieved about 4% growth in the women employment. Members made a total 41 commitments, of which 85% were completed and still they were ongoing. And as of September 2016, the partnership reached to the lives of 313,000 women. She Works was very well publicized. We went all over on the social media. The Twitter was the in thing at that point of time, and we really leveraged that platform. More than half of She Works members signed the Women's Empowerment Principle. In fact, our CEO had also signed up this program on the Women's Empowerment Principle. So these were very well received and an achievement which was to be celebrated, and we did it with a great show under the guidance of IFC. Yes, please. With this, I move to the presentation about us. So currently, like Zulekha Hospital is a UAE-based healthcare group. We have two hospitals. Currently, I'm based at Dubai. So Dubai and Sharjah, there are two Emirates wherein we have our hospitals. So just to understand for the people who are not from UAE, and UAE population is 9.89 million, out of which 3 million are the women. And this I'm talking about a total population, including the expats. And as you know, here the expats numbers are close to 80% out of the total. So this is a census data based on 2020. Next presentation. Yes, the uniqueness about our hospital is that it's a women-owned and women-managed organization. Our commitment to the gender-inclusive workplace is like the basic foundation of our group. It's not that we learned today, it has been there right from the beginning because of our founder of the organization. She encouraged more women to come on board. Currently, we are constituting 62% of workforce. I'm talking about the women. We are 62% out of the whole thing. When we started with She Works, we were just 58%, and then we grew by 4%. And after that, we have maintained those numbers. Zulekha Hospital had partnered with Clinton Global Initiative primarily to increase the employment of, in fact, I would say to learn the best practices, with the industry experts over there. And we wanted to learn more from the IFC, how it is driven and what it is to be done. And of course, we wanted to drive our initiative based on certain measurements, certain principles and all. So, and we were immensely benefited for this association. So the employment opportunities, a conscious effort was put in to increase the employment opportunities. We wanted to bring out certain kind of new policies, which we did around this. Our group is headed by our co-chairperson, Ms. Zaromia Shams, and she is a leader who actually drove this She Works program to a next level, because she participated in almost all global platforms. She spoke about our program, and we showcased our hospital in such a manner that, yes, we are women-owned and women-managed organization, but we have so many plus points which we added, driving certain initiatives on the gender equality. The executive management committee of the group had appointed me to drive this initiative. And again, this year, again, they said, when this program came up, they said, Vijaya, you have to take this forward. So there I am. Next slide, please. Jamila was also there for this program that is from the EDGE certified. This is certainly a very good certification program, which I got to understand during this annual meet, which was organized by the She Works team. We met up in Switzerland, and there were about 50 organizations which had come, and I think most of them had gone for this EDGE certification. The next. Yeah. So the She Works commitment was very well received. The 2 years program, we were able to bring in certain kind of new initiatives. A conscious effort was put in to drive these measures. In our hospital, we worked on certain areas like bringing in the policy change, like anti-sexual harassment policy, or increasing the women in leadership, or even bringing the mentorship and sponsorship program. So there were some of these things which we did it for our organization. Next slide, please. There were lots of forums that I spoke about the knowledge sharing forum. As you know that, a hospital caters to all kinds of patient demographics, but primarily our patient demographic comprises of women and children. Although we are a multi-speciality and tertiary care hospital, but there are certain conscious initiatives which we drive year on year, and there is a calendar plan for it. So the one is about the breast cancer awareness, which we did it like Think Pink and Think and Pink, this kind of thing. Then there was cervical cancer program, which was pap smear test and other tests were given free of cost. And there were many other programs which we drove. We also came out in media that how we are working on the She Works partnership and how we are driving. So these are some of the clippings from the program. Yes, please. Okay, so the challenges what we were facing, in our hospital or in this region, I would say that you have a contractual obligation to work in UAE. Which is transparent and good. There is nothing wrong about it because you have a work-life balance, you have a contract to finish, so a 2 years contract or something. This is how we work. The contract also talks about the fixed working hours, so which is again a good thing. But then the fixed working hours are as long as 48 hours per week. These contracts doesn't really have the flexibility of making it a part-time or like a few hours association. This kind of thing is not possible. However, the government is constantly working on bringing in some of the part-time kind of contracts. So this was something which was the flexibility schedules for the working mothers was not possible, and we were trying to work on that. The second was about most of the women workforce who enter UAE. As I said, that most of them are expatriates. They are dependent on the spouse. The spouse has an employment, they move in with the employment of the spouse, and then they look for a job. So the dependency on the spouse is very high. We wanted to address that area. Secondly, the maternity leave here is just 45 days, whereas most of the countries are having maternity leave as long as 6 months also. As I belong to India, in our country, it is 6 months. So here, the limitation on the maternity leave was also one of the things. There was like a part-time job. We wanted to see that, if there was a possibility of creating a part-time job, because people who came in, they wanted to have, look after the children as well as work. So they were looking for a part-time possibilities also. So during this commitment, when we entered the She Works, we addressed on some of these things through signing up our commitment, and we were successful in increasing the women's strength by 4%. Next slide, please. The first commitment which we entered was about the company-wide gender assessment. Now, I'm sure you must be wondering that, did we go for EDGE certification? Well, we did not opt for the EDGE certification because that was pretty new at that point of time. And we wanted to really understand our own assessment methodology of doing it, because we were doing several assessments within the organization. So we did company-wide gender assessment through our own methodology. We had online survey programs. We collected the data. We we had our in-house HR metrics to see the gender gaps, the pay gaps, the gender gaps, the numbers, everything. We were able to address that. So we looked into those data, and what we saw is that there is a need to create certain policies, which can help appointment of women in those departments which lack a women representation. So through the gender gap assessment, we were able to understand which are those departments which are having less representation of women. So there was a conscious effort of driving recruitment in those departments particularly. So we did that. Then we brought in a policy called sabbatical policy. Well, as per UAE labor law, this kind of policy is not there, but this was a customized policy which we brought in to help the women employees to extend their leave or take a sabbatical of 3 months or 4 months or 5 months, which they can do it. So this is another feather in the cap, or you can say, which was helping our commitment to drive our commitment. We designed development programs for the nursing and administrative areas, because these are two areas I would say, from my 62% of women workforce, 50% of them are the nursing. And we had taken certain measures to ensure that, there is a development program to develop the leadership. We created certain hierarchies, because unless and until you create certain positions, you cannot actually drive the staff saying that, well, there is a development program for you. So we have to show a career path, career progression for them, which we did by creating those kind of positions in the organization, in the department, in the nursing, which was never heard of in this region. Because if you join organizations, people look at just your license. So primarily the nursing who are working here are having a registered license. So what is so different about this nurse and the other nurse? So we wanted to show there is a development program, there is a career path for you, and you can actually move up the ladder from a staff nurse to an administrative role as well, and actually carry your current role also. This is how we created the position. Next slide, please. The second commitment was formulating an anti-sexual harassment policy. This was a policy which is completely unheard in UAE region, because the law is strict here and everything is very clear, there is a protection cell, there is a safety for women. But however, when we read through this policy to understand, there is so much to understand, because people really don't know what actually is anti-sexual harassment. So we defined in fact, we gave a clear definition of this policy to people to understand that even staring, a simple staring leads to a sexual harassment, or it doesn't mean just a touching, but even a constant staring, or sending WhatsApp messages, or intimidating a woman or a male member is definitely comes under this. So we made this policy covering all genders, not just for the female, but we made it to all genders, and it was very well received and appreciated by people. And you'll be really, I'm very happy to share this with you. It's been 4 years since the time we have closed on with the She Works. Again, this policy is very much in place. We are driving this policy through our orientation programs and the normal training programs. We educate, we create those kind of awareness. It's a continuous work. So we haven't stopped anything which we did about 4 years back or 6 years back. We are still continuing on this policy, and we really, happy to commit for this policy and get for this. So we created, awareness on this program. This is what I wanted to summarize on how we drove this policy. Next slide, please. The third commitment was a very important commitment, driving this through the leadership thing. So our co-chairperson, Vijaya Sen, she had signed up this women empowerment principles to share knowledge and best practices with the like-minded business leaders. So when we went out on all the forums, we spoke about this. We conducted programs to create the awareness and telling that, yes, we have to move our conversation from why hiring women to how we want to hire women. So this was very well received by everybody.
Discover the ultimate healthcare experience.